Hello, this is discussion number 7, how to EMS. I want to talk about how to properly do an IV. Couple things to go over, just basic knowledge. First thing you want to do is talk to the patient. Sometimes if they have extensive medical history of cancer, or on certain medications, or are in and out of the hospital on a regular basis, they'll actually tell you they're a hard stick and where to get the IV. They can tell you the best place to go, where they've been most successful, and where they usually get IVs, or they have gotten IVs in the past. Step number 2, you want to place a tourniquet. Tourniquet is a venous constrictor, not a venous occluder, so don't place the tourniquet too tight. You don't want to cause more harm to the patient. And try not to have the tourniquet on longer than two minutes. Remember to lower the patient's arm, allow the vein to puff up. You can also feel for a vein. If you can't see them, you can feel around your own arm to get the idea of where they could possibly be. Pick a proper site. Remember, you want a vein that's straight, non-bounding, doesn't have any valves. Once your site is found, you want to clean it good with an alcohol prep. And make sure you have everything you need before you start the process, before you start the IV. For example, remember to have a VenaGuard, tape, an IV bag, a J-loop, everything you need before you start the process. Also remember to pull traction on the arm so the veins don't move. Remember to talk to the patient. Sometimes people that haven't ever had an IV or don't like them, they get nervous, so try to talk to your patient, calm them down. Remind them, let them know that they're going to feel a small poke in their arm. They possibly may want you to do a countdown for them, and just advise the patient not to move the arm while the process is going on. Try to place your needle at a shallow angle, something along and line it up with the vein. Place the needle at a shallow angle before you attempt the puncture. Once you do puncture the skin, make sure you look for a flash, and once you have flash, you want to stop. You may possibly want to advance the needle slightly more, but not very much. And once you have their flash, you want to go ahead and advance your catheter. Then once you have that, go ahead and apply your IV bag or J-loop. When connecting the IV catheter to the bag, remember to put a 4x4 down. You may have some blood returned. And if you follow all the steps, you should be successful with your IV. So congratulations. If at any time while attempting an IV, patient's complaining of more pain than normal, or painful to the site, or if you notice infiltration to the site, stop the process and discontinue. Don't get discouraged if you miss. Nobody gets them all. This is discussion number 7. Thank you for watching.